All right.
Hello, my name is Javier Martinez, and I will be representing the negative side of the debate. And to begin, our opponents proposed the issue of that having assisted suicide, not having assisted suicide would cause problems. However, this only addresses a very small issue, and in fact is a bit discriminatory, because the current law in regards to assisted suicide only focuses on those individuals who only have 6 months to live or are in a state of mind where they can give consent. And this is problematic because there's a lot of people, for example, with certain diseases which take much longer to kill the person, yet they're in a lot of pain. For example, Sue Bronson, who was a professor of psychiatry and behavioral sciences and psychosocial and community health nursing at the University of Washington. She stated in regards to this, what of those who are too disabled to request that their suffering be ended, such as infants and demented, who should be denied the benefit of a hastened death? Does not compassion provide an even more compelling reason for a doctor to provide this release from the suffering and dignity? And this does seem to be the case. An Alzheimer's patient, for example, can take up to years for this disease to eat away at their brain, and yet they would not qualify for something like this. Another issue with this is also that the claim is that people want assisted suicide because they're in pain, but actually this many times is not the case. For example, Ezekiel J. Emanuel, who wrote the article in the Atlantic, "Whose Right to Die?" He mentioned that according to the Remlin report, which was the first official government study conducted on assisted suicide and euthanasia in the Netherlands in 1990, it found that patients in nursing homes in the Netherlands revealed that pain revealed that pain was not among the reasons for requesting physician-assisted suicide or euthanasia, and it was only the case in 29%, and it was only the main reason in 11% of these cases. Another study conducted in Washington by state physicians found that many times the reason for these patients requesting assisted suicide was not in fact because of they were in pain or because they were necessarily in mental anguish, but it was more their fear of losing their control, their dignity, or being a burden, or not being able to be independent. And this simply cannot necessarily be the issue to base our laws on, because dignity is actually an invalid reason to end somebody's life. Many claim that they want to die, remembering the person as they were. However, this is, as we can see, this is problematic because it's hard to tell all the time if it's really for the pain or is it psychological issues. And when it is a psychological issue, there have been instances where people have sought out counseling, they've gone to support groups, things like this, and it's actually changed their mind a lot. Now to the inherency claim that the current system is flawed. This is an issue because once we start implementing a new system where we say that it's okay to end a person's life, we start going down a slippery slope because it takes the doctor's focus away from saving people's lives, and it's no longer about preservation because it's the powers in their hands to end someone's life. And in fact, in an article found in Newsweek called "The Physician-Assisted Suicide is Always Wrong," it mentions part of the Hippocratic Oath, which says, "I will keep the sick from harm and injustice. I will neither give a deadly drug to anybody who asks for it, nor will I make a suggestion to this effect." So, as we can see, this is the oath that doctors take before becoming doctors, and that's, basically they vow they're gonna do everything in their power to save someone's life. And in this case, they're doing the opposite. Another problem with this is also that it takes away the possibility of leaving more time for research to be done in hopes for a cure to help these individuals who are in pain. If they just, have the idea, I don't want to be in pain no more, they're not going to have the time to, who knows, maybe there will be a cure in the near future. Is it likely? Maybe not, but it's at least a possibility. And in the same article, "Whose Right to Die," published in the Atlantic, the author mentions how rather than creating a perceived need for physician-assisted suicide and euthanasia, advances in life-sustaining technology should help to obviate them. Patients are being kept alive by technology and want to end their lives already have recognized constitutional right to stop any and all medical interventions from respirators to antibiotics. They do not need a physician-assisted suicide. So basically it's talking about a patient's right to reject, say, their respirator or their medication. They have these options, but it becomes a little different because if, say, somebody's respirator gets unplugged, now what's killing the person is actually their own disease and not the doctor. So this is a little different. And to the final solvency claim that
You're out of time.
Thank you.